We have now opened the right thoracic cavity. We followed the same way to open the thoracic cavity on the right side, cutting along the costal cartilages on the ventral aspect, breaking the ribs before we flip or before we reflect the wall, and cutting along the costal arch. The same thing we did, like we cut the costal arches here, costal cartilages here as well. Flipping the wall, we can now see the right lung. The right lung of the dog is little different than the left lung. The same apex as well as base of the lung is present, and then we can see like there are two oblique fissures which runs through and through to divide the lung into three major lobes that are visible from this side. There is one more that is not visible as yet. So what we have the cranial lobe, the middle lobe, and the caudal lobe of the lung. But then we'll include that description in little later part. Let's look at one of the important ligament associated with the lung. Though it is partly broken in this dissection, we can see the caudal lobe of the lung is attached to the mediastinum, specifically the caudal mediastinum, by means of a thin membrane which we can see right here, which is formed by reflection of the pulmonary pleura into the parietal pleura, dorsally as well as ventrally, and that structure is called pulmonary ligament. So now the pulmonary ligament is only present in the caudal part of the lung in both right as well as left lung, attaching the caudal lobe of the lung, both right as well as left, to the mediastinum. Okay guys, so let's look at the right side thoracic cavity. As we open the right side thoracic cavity, we looked at some of the features of the lung. We saw the apex of the lung, the base of the lung, the oblique fissures. There are two of them, so the lung is divided into cranial lobe, middle lobe, and the caudal lobe. The right lung, as the cardiac impression on the right lung is slightly deeper, it forms the cardiac notch. As we take the lung out of the thoracic cavity, now we can see the accessory lobe of the right lung also, which is situated into this space, which is basically part of the right thoracic cavity, or let's say right pleural cavity. Further compartments are because of the presence of the plica vena cava and the caudal vena cava. Now on the left side, we saw the mediastinum has been pushed more on the left side, so we can see the mediastinum more on the left, basically the caudal mediastinum. Here the esophagus, we see the azygous vein, those are still in the mediastinum, but then from this point below the this point ventrally, the mediastinum has been moved more on the left. The caudal vena cava, as it has to come into the right chamber of the heart, it is more placed on the right side. So this is your caval foramen, through which the caudal vena cava is coming into the thoracic cavity and joining the right atrium. So this is specialized fold of the parietal pleura, which wraps around or which goes around the caudal vena cava and that caudal most part of the right phrenic nerve, which accompanies the caudal vena cava. And so that is your plica vena cava. The plica vena cava would run between the diaphragm, the pericardium, and the caudal vena cava. So this triangular membrane that we see right here, that is the plica vena cava. Now if you see on the left side of the plica vena cava, the space I am pointing out with this probe now, that space is between the plica vena cava and the caudal mediastinum, basically the ventral part of the caudal mediastinum, and that space is called mediastinal recess. In this mediastinal recess, we usually find the accessory lobe of the right lung completely occupying that space. So that is your mediastinal recess. The azygous vein, which is present on the right side, draining the dorsal intercostal arteries from both sides, right as well as left. The esophagus, the caudal vena cava, phrenic nerve, the plica vena cava, the heart located obliquely with base of the heart more cranially, apex more caudally, and we can also see the phrenico-pericardiac ligament from this side as well. If I try to pull the heart slightly upward and pull the sternum a little bit lower, I can see the membrane below that, that is also the mediastinum. So here we have the right thoracic cavity completely separated from the left one by means of having the mediastinum, and in the right thoracic cavity we do have another compartment which is connected to the rest of the cavity, that is your mediastinal recess, which occupies the left accessory lobe of the right lung. Okay. Some of the other features that we see, that is your right subclavian artery, the right internal thoracic artery. The same branches as we saw on the others on the left side are going to be present here. So we see here further continuation of the internal thoracic outside the body, outside the thoracic cavity is cranial epigastric artery, coming more superficially on the body wall just below the skin, that is your cranial superficial epigastric artery, which is also accompanied by the similar vein. Okay, so we have cranial superficial epigastric artery and vein, cranial epigastric artery and vein, which is present outside here. Now, as we follow the inner surface of the wall of the thoracic cavity here, this is the musculophrenic artery, and which is going to accompany the costal arch and gives off the costal or ventral intercostal branches in this region to anastomose with the dorsal intercostal arteries as well as the veins. Okay? So that is your musculophrenic, which is continuing further, or which is branch of the internal thoracic. The internal thoracic vein or internal thoracic trunk is formed by combination of both of the internal thoracic veins as they come together to form the internal thoracic trunk, which eventually enters the cranial vena cava. The large vein located here is your that is your costocervical vein. As we have the costocervical artery, the costocervical vein is draining that area. That large vein that is seen here, along with your superficial cervical artery, that obviously is your superficial cervical vein, which is not really coming into the thoracic cavity, but it's draining right into the external jugular vein before it becomes the right brachiocephalic vein. As the subclavian joins that one, then it becomes right brachiocephalic vein. Okay. The azygous vein, which drains the thoracic wall, and it brings all that deoxygenated blood into the right atrium. Here again is the pulmonary artery. These are the collapsed pulmonary veins, the small one, the big one here, as well as the small one here. The artery is going to further divide into several branches to get into the lung. Then the lymph node here is your right tracheobronchial lymph node. The phrenic nerve, it runs along the cranial vena cava. As long as it runs along the cranial vena cava, it is still within the mediastinum. This is cranial mediastinum, as it goes around the cranial vena cava, brachiocephalic trunk as well. And then we have the phrenic nerve running along the cranial vena cava along the right lateral surface of the heart, and then it continues further to the caudal vena cava and then to the diaphragm. And so here, the right phrenic nerve, the caudal part, is also included in the tricca vena cava. Okay, so we'll look at the brachiocephalic trunk and few other things on the right side. Most of them we already have seen on the left, but then some of those which would not be really present on the left side, which are specifically on the right, like your azygous vein. And this specimen also shows very good thoracic duct, or the right side part of the thoracic duct, present right below the azygous vein. The one which is slightly blackish tinged vessel is your thoracic duct. The remaining part of the thoracic duct, as it moves more cranially, would be on the left side of the thoracic cavity, and that change would occur usually at the level of 6th rib or 6th intercostal space. So this is your thoracic duct. Right above the thoracic duct, we see the azygous vein draining the intercostal or receiving the intercostal veins, but remember it will receive intercostal veins from both sides. As we remove the parietal pleura, we can see the sympathetic trunk. We're not going to spend much time on that. So that is your sympathetic trunk, your stellate ganglia on the right side. We transected this costocervical vein, so we can lift it up and we can see the underlying structure. So that is your ansa subclavia. Now at this point it is looped around the right subclavian artery. We have the similar branches of the right subclavian as we saw in the left subclavian, but let's look at this one first and we'll go to those branches. So we have ansa subclavia. It joins the vagus nerve at the lower part of the ansa, or the distal end of the ansa. So this is your middle cervical ganglia. So from this point backward, this is your vagus nerve only. From this point forward into the neck, that is your vagosympathetic trunk. The vagus nerve, as usual, is going to split into two branches, but before that it gives off the recurrent laryngeal nerve, that is your right recurrent laryngeal nerve, which forms loop around the brachiocephalic trunk. Let's differentiate the ansa subclavia and the recurrent laryngeal nerve. This is ansa subclavia right here, or one of the branches of the which forms the ansa, and this is the recurrent laryngeal nerve. So we see the recurrent laryngeal on the right side, we saw the recurrent laryngeal on the left side as well. Further continuation of the vagus nerve, as it did on the left side, here also it splits into the dorsal branch of the vagus nerve, ventral branch of the vagus nerve. That's the ventral branch of the vagus nerve. Both of the branches are going to join their counterparts and form the dorsal and ventral vagal trunks. The phrenic nerve, here we can even see the origin of the phrenic nerve, or the nerves which contributes to form the phrenic nerve. So we have your C5 as well as part of C6, both of them, they coming together, the phrenic nerve right here. Okay, and then it continues further along the cranial vena cava, along the lateral side of the heart, and then goes along the caudal vena cava, through plica vena cava, and reaches the diaphragm. Quickly look at the branches of the right subclavian: costocervical artery or costocervical trunk. Then we have the vertebral artery as usual, going slightly deeper, going towards the vertebrae. Superficial cervical artery, internal thoracic artery. Further continuation is your axillary artery for the right forelimb. On the left side, left subclavian would continue as the axillary artery for the left forelimb. After this, your brachiocephalic trunk is going to go further, as it will give the right common carotid artery as well as left common carotid artery. So we can look at that one. So that is the right common carotid, further going and would be wrapped by the carotid sheath. The left common carotid would arise before the right common carotid from the brachiocephalic trunk. So when I try to go a little deeper, that is my brachiocephalic trunk. The larger blood vessel that I see here, that is the brachiocephalic trunk coming off the aortic arch.